Hello, my name is Stephen Denman. My organisation is Shining Guidance. My website is shiningguidance.com. I'm going to talk to you today about those individuals who have autism spectrum disorder or ASD and how they cope as best they can in intimate relationships with their partners. I will also be looking at the various characteristics and traits that tend to be rather commonplace amongst those individuals who are suffering with autism spectrum disorder or ASD, and look at maybe the main solution to the problems, which is very simple really in its approach and its application. And I'd also be looking at individuals that are either academics that discuss in detail autism spectrum disorder or ASD, which includes obviously Asperger's syndrome, or they are academics who themselves actually suffered with autism spectrum disorder ASD, but actually prolifically wrote about human psychology and mental health issues in their work. So we know already that those individuals that have autism spectrum disorder tend to be at an increased risk of suffering also with different aspects of clinical depression or with major depressive disorder, MDD. They can have social anxiety issues. They could have aspects of obsessive compulsive disorder, OCD, or attention deficit hyperactivity disorder, ADHD. Or they can have aspects of any of those intermingled, which defines them as an individual with autism spectrum disorder, ASD. Now we know that the partner in the relationship, whether that's as a in a relationship as a boyfriend and girlfriend or a husband and wife, you know, tends to either want vast amounts of sexual activity on a very regular basis, literally sometimes 3 to 4 times a day, every day of every week of every month. They have obviously in that situation have taken their very fixated routine forms of thinking and behavioural patterns and have transferred their line of thinking into their sexual expression with their partner. So that in itself has become very fixated. It's almost like a ritualistic form of sexual expression on a daily basis, sometimes as much as 3 to 4 times a day. Now, obviously, that puts a huge amount of pressure on the partner who has to perform. They may feel inadequate and worthless, or they're not up to the mark. They may feel like if they don't please the other partner who is suffering with autism spectrum disorder or ASD, and we have to remember that the individual in the relationship who has autism spectrum disorder or ASD may not even be officially diagnosed by a general practitioner or GP. So other individuals who suffer with autism spectrum disorder ASD may try to minimize their own sexual and emotional intimacy with their partner. They may decide that they don't want to really engage at all in regular sexual activity or even just emotionally expressing themselves. They're not going to even engage in daily or weekly dialogue with their partners over that. And then we have those individuals who suffer with autism spectrum disorder ASD who don't want any sexually or emotionally based contact with their partners. They may well have had that on a regular basis. Then they decide, for whatever reason, that they don't and withdraw from them. Obviously, this creates a sense of loneliness, sadness, frustration, bitterness, and anger in the other partner, who may take it very personally that they've done something terribly wrong to the other partner, especially if they're aware that the other partner in the relationship has autism spectrum disorder or ASD. So we know that it's a complex subject. We know that there's a lot of struggles and a lot of efforts that go on for those individuals who have autism spectrum disorder ASD to maintain healthy and clarified, trustworthy relationships with a member of the opposite sex, whether they are boyfriend and girlfriend or they are husband and wife. It's very, very difficult for them. And it's difficult generally because obviously people who have autism spectrum disorder ASD find they have social interaction problems. They can suffer from social anxiety issues. They find it a struggle to cope in the workplace, especially if their workloads are changing. The daily routine is being challenged in some way. They may have a complex or difficult customer or client, or they're working with another organization or business. They're under tremendous pressure. Key performance indicators have to be reached on a daily, weekly basis. Obviously with one of their line managers or a departmental manager it's difficult for them. So the same thing happens in relationships, because in the intimacy of a relationship, for them to really express themselves sexually and emotionally in a positive, mature, adult fashion that makes their partner feel wanted, needed, and loved and respected can be a big struggle. And the thing is, it's not personal to the partner who doesn't have autism spectrum disorder, ASD, that is taking place. It's simply because of the neurological and mental health condition that their other partner is suffering from. So, we have to understand that when, for example, an individual who has autism spectrum disorder suddenly starts to become rather robotic and unemotional in the bedroom, between the sheets, shall we say, and with their partner, they find it very difficult, that the partner can really take that to heart, that something terribly has gone wrong. So, the individual with autism spectrum disorder, ASD, may actually be experiencing sensory based sensitivities. And I'll go on to discuss what they are in a minute. But a partner, who is suffering with autism spectrum disorder, ASD, therefore may go days or even weeks or even months where they just become completely engrossed in their workload, their daily schedules, their own specially centered interests and intellectual pursuits. This is known as parallel play, and it can leave the other partner feeling terribly rejected and abandoned and alone, and they feel upset, they feel sexually inadequate. It can affect their own libido as it affects the libido and the mental health, and therefore the psychological outlook of the other partner who is suffering from autism spectrum disorder, or ASD. Now, common activities that may have brought the couple together in the past therefore seem to fail, and therefore perhaps the partner who doesn't have autism spectrum disorder, ASD, is then going to think, is the relationship coming to an end? So if they're a boyfriend and girlfriend, the relationship is ended, they separate. If they're husband and wife, they legally will get divorced. For both, that would be catastrophic, both emotionally, sexually, but also financially and economically. And the long-term mental health problems that will then cause for those individuals, especially the individual in the relationship who has autism spectrum disorder, ASD, is just going to make things even worse for them over the next sort of 5, 10, 15, 20 years of their life, on planet Earth. So we have to understand that there are positive things that can be done to logically counteract any risk of these kind of problems arising in intimate relationships where one of the partners has autism spectrum disorder, or ASD. And the key to this is to create a new challenge that will somehow become a fixated routine itself that can overcome by being integrated with the fixated routines, both in terms of thoughts and behavioural patterns of the individual in the relationship who has autism spectrum disorder, or ASD. So that would include using initiation, consistent receptive listening, planning and goal setting on a daily basis, but done it in a very compassionate, methodical and slow and calm way. Now that would take perhaps advice from outside, that relationship, from a qualified counsellor or psychotherapist or some kind of charitable support group that can help that couple maintain their relationship, because one of them obviously suffering from autism spectrum disorder, or ASD, but deep down they truly love each other. There's a mutual bond of love, respect and trust that is so intense they don't want to lose that by either separating or legally getting divorced. So the key deep down to all this really is the simplicity is communication. Key to all is communication, honesty, integrity, and emotional expressing what is going on. Now, individuals with autism spectrum disorder, or ASD, often experience tremendous amounts of internal distress, sadness, concern, disorientation because of their sensory type sensitivities. Now, an individual who has autism spectrum disorder, ASD, has senses that can sometimes be hypersensitive, which means they're being overly reactive to the sensorial environment around them, or they could be hyposensitive, which means they have a very diminished sense of sensitivity to the environs around them. So the partner who isn't suffering with autism spectrum disorder, ASD, could gently caress the partner who is, and it may feel intensely hot or intensely cold. They may become frigid. They may feel a sense of revulsion. They may feel intense tingling or jabbing sensations on the surface of their body, which don't bring them any sense of comfort. They may feel absolutely no kind of affectionate, emotional based response to the partner from them being, affectionate and loving to them. They just become completely cold and switched off from them, and there's that frigidity, that emotional, shall we say, stagnation is therefore activated in them because they are suffering with autism spectrum disorder, ASD. So the key here is using those challenges of initiation, planning, and goal setting, and bringing them together to overwhelm in a positive and progressive and methodical way, and surround and encapsulate the original fixated thought and behavioural based routines of the individual in the partnership who is suffering with autism spectrum disorder, ASD, and integrate them in a logical way over days, weeks and months so they can maintain that relationship. So the key is obviously managing sensorial triggers is a very important aspect to dealing with maintaining intimacy in the relationship. So that cannot be in any way underestimated. It's extremely important to understand that. Now, I could go on talking about these different aspects, and therefore, I suppose, the risks associated with relationships where one individual in there has autism spectrum disorder, or ASD, and how that individual may actually destabilize the relationship unless both of them are fully aware of what's going on, communicate regularly, emotionally express themselves in a logical fashion, and use various communication tools and aspects of developmental thinking to really outgrow those fixated thought and behavioral based patterns that the individual in that relationship and partnership, is obviously as well, is constantly experiencing. Now, we know that there are many individuals who do research into autism spectrum disorder, ASD, who are academics. One of these individuals is the American psychologist known as Ashley Stanford. Now, Ashley Stanford wrote a book called Aspergers Syndrome and Long-Term Relationships. And in that book, she goes into great detail of the common traits and characteristics of those individuals who are suffering with autism spectrum disorder, ASD, especially those individuals with Asperger's syndrome, in reference to how they're interacting sexually and emotionally with their partner as best they can, and the struggles they face. Now that book that she wrote, Asperger's Syndrome and Long-Term Relationships, is a very important book. It covers a huge amount of very relevant and poignant information on this subject. Another individual who really was fascinated by what would later be called, not at the time he was alive, but later on would eventually be called autism spectrum disorder, ASD, is the famous English polymath known as Francis Galton. Now, he was known to be obviously a sociologist and an anthropologist and a geographer and inventor, but his main area of interest, really was human psychology, behavioural psychology, clinical psychology. Now, the English polymath known as Francis Galton was actually an individual who displayed all the traits and characteristics of someone who was suffering with autism spectrum disorder, ASD. And yet he was able to take his own traits and characteristics, his fixated, academically based, rigid thinking and behavioural patterns, and place them into doing scientific research into human psychology and therefore behavioural psychology, specifically centred around the various traits and characteristics that would go on to collectively define what is now known as Autism Spectrum Disorder, or ASD, which obviously includes Asperger's syndrome. Another very famous individual who also actually suffered from Autism Spectrum Disorder, or ASD, is the Austrian British philosopher who is known as Ludwig Joseph Johann Wittgenstein. Now, he worked primarily in understanding human logic, also connected to ergonomics, which is efficiency in the workplace, the philosophy of mathematics, the philosophy of mind and cognition, but specifically centered on human behavioral issues in regards to the philosophy of mind and cognition and the philosophy of language and linguistics. Now, the Austrian British philosopher, who was known as Ludwig Joseph Johann Wittgenstein, was not at the time somebody who could then say to himself, yeah, he knew that he was suffering with autism spectrum disorder, or ASD, but he fully integrated his own neurological and mental health condition into his own scientific research. So therefore, truly another profound individual. We have the German-British academic who is known as Professor Francesca Gabrielle Elizabeth Happe. Now, she is the Professor of Cognitive Neuroscience at King's College London, and for well over 30 years has been intensively and extensively studying Autism Spectrum Disorder, or ASD, including the different aspects of Asperger's syndrome in women and the elderly. Now, that's interesting because it's well known that 90%, or we're told it's 90% of those individuals who have different aspects of Autism Spectrum Disorder, or ASD, are male. So she is specifically focusing on the other 10%, which is obviously female, and the elderly. She is also a fellow of the British Academy and the Academy of Medical Sciences, and she's an individual who's really done some very profound scientific research into understanding Autism Spectrum Disorder, or ASD, in women and the elderly. And up until the research that she did, really there was very little information about what was going on with Autism Spectrum Disorder, or ASD, with the elderly, because a lot of the conditions they also have as elderly people were really superseded in terms of study, as opposed to looking at the traits and characteristics they were having at the time while they were alive or nearing the end of their lives on planet Earth, which really define them suffering from Autism Spectrum Disorder, or ASD. So the German-British individual, known as Professor Francesca Gabrielle Elizabeth Happe, is a very profound academic researcher indeed, as the Professor of Cognitive Neuroscience at King's College London. So, it's interesting to note that Professor Francesca Happe also studied experimental psychology at Oxford University as the basis for her own educational development. So she is somebody that has a really comprehensive understanding of experimental psychology in regards to mental health issues, in terms of using diagnostics and data and statistics and just general scientific observations of individuals that are suffering with Autism Spectrum Disorder, or ASD, which obviously includes individuals with aspects of Asperger's syndrome. So this is a huge subject, and those individuals who have autism, they find it very difficult to get on with their lives in any effective manner. Sometimes they're so terrified of expressing themselves, so terrified of being ridiculed, of being judged, of being harshly criticized, observed, scrutinized. It's seen as an individual that is somebody who's an outsider and therefore an outcast in society. And there is a huge problem with stigma in countries like the United Kingdom of Great Britain, in countries like the Irish Republic, in countries across mainland Europe, that's Western Europe and Eastern Europe, and across the United States of America, and of course, in Canada and many other parts of the world where there's very little understanding of Autism Spectrum Disorder, or ASD. It's a subject that is still classed as taboo, just as generally any mental health issues are classed as taboo in many parts of the world, which is a terrible shame because those individuals that are suffering with autism spectrum disorder or ASD are unique, profound, extremely intelligent, and are very productive, and can become those kind of individuals that can make a very positive contribution to all societies in any part of the world if they're given that help and assistance and empathy and compassion, and they feel fully supported. There's a lot of receptive listening to their needs and wants. It's not something that should be sort of brushed away, pushed away, and ignored. It's a very important subject to discuss. But autism is a very large scientific discipline to really go into, and individuals that suffer with autism really find it very difficult in life generally just to get up in the morning and try and be as flexible in their thinking as possible. The rigidity of their thoughts, their behavioral patterns are a safety mechanism. So in a relationship where there are going to be dynamics, there's going to be constant changes, whether that's both sexually and emotionally, or whether it's in terms of marital fidelity, whether it's in terms of the financial aspects of maintaining that relationship. There's many different factors there. It's a real struggle for them. And yet deep down, every individual who has autism spectrum disorder or ASD wants to be loved, wants to be included, wants to be respected, wants to form a bond of trust. And deep down, every individual that has autism spectrum disorder truly just wants to be loved and respected, and really would love a partner for life. Whether they're boyfriend and girlfriend or husband and wife, doesn't matter. They want that intimacy deep down, even if they're not consciously aware of it because of their own neurological and mental health conditions. But anyway, I think I've given enough information in this presentation. It's a very large subject area. It's fascinating. I've certainly enjoyed presenting this information to you. There'll be many more videos to come in the very near future, and I hope you've enjoyed watching this presentation, and I will speak to you all soon. Take care, everybody.